Together we achieve victory over heart failure.
Hello, I am Dr. Mehraj Shah. I am a senior consultant cardiologist in Srinagar. I just want to tell about this heart failure. Heart failure is a condition where the patient's heart is compromised to act properly, and the function of heart is pumping blood into the body. Once the heart becomes compromised, this function is decreased, so that heart is not able to pump the blood in the right content. How we diagnose it? Usually we diagnose it by echocardiography, and we calculate what is known as ejection fraction. Ejection fraction is how much of the blood is ejected from the heart in one beat. On echocardiography, ejection fraction normally should be more than 55-60%. If this ejection fraction becomes less, then we say that patient is in heart failure. And another way to diagnose this heart failure is if patient has symptoms of heart failure, then we do what is known as NT-proBNP levels in blood. We see the content of how much is the NT-proBNP levels. Normally less than 400. If it is high, then we think that patient is in heart failure. Which patients we see that patients are in heart failure? The patient comes with symptoms of breathlessness, easy fatigue, not able to do his usual work properly. He cannot go upstairs, he cannot walk for longer distance as he used to do. That time we suspect the patient has heart failure. And that time we try to go for these investigations and confirm that patient has heart failure. Heart failure is now very common in India. And we see that it is related to so many conditions, what we call as risk factors. Because these risk factors are very common, that is why this condition of heart failure is common in India. We need not to be scared of this heart failure, but we have to take care of heart failure, and we have to be in contact with the concerned doctor, whatever you are consulting, especially if you are consulting a cardiologist. Then if you are in touch with cardiologist and if you take drugs properly, you need not to be scared of this disease. And the conditions why it is common in India is that we have these risk factors, what we call them. These are just like smoking is very common in India. Then hypertension has increased recently. And this incidence and prevalence of hypertension has increased. Diabetes is very common in India. Obesity is very common. So these things have increased day by day. That have led to this condition. And these are the risk factors for development of heart failure. And ischemic heart disease. Now we see that diabetes and ischemic heart disease is very common in India. Ischemic heart disease means that blood flow to heart is less. Blood vessels are damaged. That leads to less oxygen supply to heart. That leads to weakening of heart, and the patient goes into the heart failure. And usually we have to be in touch with doctor. In addition, we have to take care of things like we should avoid too much of exertion initially till this patient is stabilized. Then we have to change our lifestyle, like we should take less of salt. As we see in India, we take more of salt. We should take the advised salt in content is just 5 grams. Here we take more than 10 to 12 grams. So we should take less of salt, and we should take this low cholesterol diet if patient has ischemic heart disease. And we should be strictly adhering to the medical treatment, whatever doctor has advised to take these medicines. And if we diagnose heart failure and treat it properly, we need not to be scared of this disease. It can be controlled very well, but the treatment usually is lifelong, and we should not stop the treatment without suggestions from the concerned doctor, whoever is your family doctor or cardiologist or any other doctor whom you are following with. You have to follow his suggestions and medications. But most of times the patient has to take the medicines lifelong, and that should take care of this. Thank you.